Hello, everyone, and welcome to In Conversation, taking USMLE Step 1. My name is Sean, and I graduated from the University of Michigan Medical School in 2016, and now I work for AMBOSS. Today, I'm here with my friend Andrew.
Hey everyone, really good to be here. My name is Andrew. I'm a fourth-year medical student at Penn State. I'm taking an extra year to do an MD MBA.
And tonight, we'd like to go through some questions that we've gathered. These are frequently asked questions that students have about Step 1. And hopefully, as we work through these questions, Andrew and I can provide you with some value, useful strategies, tips, suggestions, etc. in dealing with this difficult exam.
All right, so Sean, I think we should just jump right in. The first question on everyone's mind is, how much does my Step 1 score matter?
Yeah, that's a good question. And to be short, I would say Step 1 matters a lot. And there's a few reasons why that is. One, from the perspective of residency programs and selecting candidates, Step 1 is one of the only objective criteria that they can use when evaluating whether a candidate is appropriate for their residency or not. It's a numerical score, and it allows them to compare across programs, across schools, and really make those objective comparisons. And number two, Step 1 says a lot about a student's mastery of certain basic science concepts, and that obviously has some relevance to providing good clinical care, and the residency programs are invested in doing that too. So at the end of the day, Step 1 is and will likely remain a key factor in residency placement or in the match process, which will take place later in your medical school years.
Yeah, and I completely agree with everything you just said. I think one thing I like to throw in there for a lot of medical students is there's so much emphasis on the exact number that you get, and many students think that if they get a good score, it's a golden ticket to whatever specialty they want. Yeah. But as a fourth year and then seeing some of my friends match go through that process already, it's become pretty clear to me that it's about the whole package.
Right.
Like, yes, you want the best score that you can achieve, and you want to try your hardest for this exam. But if you don't focus on making sure you volunteer or getting to know the specialty that you're interested in, you might still not be as competitive as you're hoping for, just because you have a number, or even if you don't have that number, you need the other aspects as well.
Yeah. The residency application process is definitely holistic, and you are more than just a number. Just in general, outside of medical school and within medical school, you're definitely more than just a number. Yep. Cool. And with that, we can move on to that next question. So what would you say, Andrew, was the hardest part about preparing for the Step 1 exam?
Yeah, so some background there. I just took Step 1 and Step 2 almost back to back, because my school does it differently, where we take Step 1 at the end of third year. So then we only have limited time to start taking Step 2. So I think there's three big things that are difficult about taking the Step 1 exam. The first is just overall, how much material there is. It's kind of crazy. Yeah. From undergrad, like a bio class you take in college, you could probably cram that out in less than a week, right? Just for that midterm exam.
Right, absolutely. I remember doing that. So,
yeah, exactly. In med school, though, it's kind of a marathon. You really have to be on top of your game the whole time over the course of M1 year, M2 year before you take that step exam to be fully ready. And there's a lot of back-end work that needs to happen. And I think a lot of students aren't used to that. That's one. The second thing is organization, just keeping... It ties very well with the amount of material there is. But I think many students, what they struggle with is because there's so much material, they can't organize it correctly in their head. So they're not building a framework necessarily. And just memorizing facts. And this, the exam is changing so that it's more critical thinking. And it's hard to just brute force memorize things without an organization.
That's right.
And the third thing, and this is huge, it's just the fear. Ever since you arrive, I remember one of our orientation sessions in school, one of the first questions a student asked, how do we do well in Step 1? When they were just trying to tell us about our schedule and things like that.
You have an anatomy lab on Wednesday.
Yeah.
How do I do well in Step 1?
Yeah, there's so much anxiety over this number, and I think that creates a difficult learning environment, because instead of thinking about, okay, how do I learn to be the best doctor I can be? You're worried about what happens to me if I get 220, 230. You start playing these mental games that aren't productive for studying.
No, that makes a lot of sense. Yeah, I can just add to that. And for me, definitely agree with everything you said. What the practical implication of what you said for me was the fact that I had trouble with time management right? That's important in all of medical school, not only in terms of step one, but when it comes to step one, there's a big challenge of managing your coursework, managing your in-house or school curriculum, and also managing step one. And that's troubling. And when it comes to step one itself, I had trouble, determining and splitting my time between researching plans, researching resources, and developing plans, and then actually executing those plans. And then when it came to executing at the end of the day, as a third aspect, it was difficult for me to manage that with all the changes that were taking place in my schedule from block to block, or just what was taking place in my personal life. And I think there's a tendency to view the dedicated period as kind of a cure-all for that. You're given so much time, and that's going to solve your time management issues. But in some ways, it actually introduces new questions, right? Because when you have 1 or 2 hours, it's easier to figure out what to do with 1 or 2 hours than it is to figure out what to do with 14 hours.
Yeah.
So the time management and how to spend your time is a question that never really goes away when it comes to step one.
Yeah.
Yeah. Cool. So I was going to ask you again, Andrew, with the next question. What are some challenges in the first 2 years of medical school related to studying or exam prep?
Yeah. So given that I finished the step one and step two now, I think I could talk pretty deeply about this.
Yeah.
One of the challenges I found difficult in year one, year two is, given everything I said about how much material there is and how you've never really been exposed to this kind of situation before, the big thing is figuring out how to study and what works for you. I remember toying around with a bunch of different study methods, like drawing concept maps. It was how you do in school, doing practice questions. Even in the beginning, I did highlighting. And I know now it's like a low-yield study method.
Fair.
Right? So you play around with figuring out what works best for you.
Right.
That's one. The second thing I found kind of difficult in the process is I think there's a disconnect between the requirements you have to do for medical school.
Yes.
In terms of what the administration wants you to understand, and then what you need to know for the exam.
Right.
So I remember going to humanities courses or health systems courses, and those are truly valuable for our education, but because it doesn't align well with what's tested on STEP, it feels a little bit like your time is so crunched because you have to balance wear all these different hats and do all of them very well.
Right. Yeah. That's challenging. That's real tough. I think for me, kind of adding to what I've said and what you've said already, one of the challenges is that step one is a multiple choice exam. Everyone knows that. And that could be a little bit different from what you experience in your medical school curriculum. But on top of that, step one is a multiple choice exam that assumes a lot of background information. And it approaches the topics from a cumulative aspect, whereas each block of medical school is not cumulative. And you can end up, really, to study well for school, focusing on certain content for 2 weeks, 3 weeks, 6 weeks maybe at a time. Where step one assumes a lot of background knowledge, and it assumes that you have studied thoroughly for those 2 years. And that can make, I think, studying somewhat awkward, because when you are prepping for step one and you are using the resources, you're not sure if you, for example, get something wrong, if that just means you haven't done that material yet, and that's something you will learn in the future, and you need to accept that fact, or this is something that I should know, and these are maybe reasoning I should have been able to execute successfully and didn't. So I think that's one reason why studying can sometimes feel awkward, and studying early can sometimes feel inappropriate. But ultimately, that's something I would still recommend in the end. And just to add on to that, as I mentioned, step one is cumulative, whereas the curriculum for most traditional schools, medical schools, is going to be M1 is going to introduce healthy function and how things work normally, and then M2 is going to be introducing diseases and treatments. And that is a further divide. As I mentioned, the cumulative versus non-cumulative, and then we have the healthy versus non-healthy. That type of divide also adds, I think, to some of the confusion and frustration that step one studiers feel during their first 2 years. Yeah.
Okay, so this is a question for both of us.
Okay.
What would you have done differently if you could go back in time, I guess, as it relates to step one studying?
Yeah, so I'm actually going to start with something that I think we'll touch on again in the context of our conversation, but I think it's really important to hone in on. And that is, I would have probably done more questions, and I probably would have done them earlier. I know that studies show that questions count, unique questions count, not redoing old questions, but unique question count, new questions, is one of the strongest predictors of Step 1 score. And I think doing questions teaches you a lot. Not only is it going to be teaching you some explicit knowledge, facts and information that maybe you didn't know or maybe you were weak on, but also some implicit knowledge, like reasoning subconsciously, and just being good at the test-taking environment and developing some comfort there. So I think questions would help me explicit knowledge and implicit reasoning, and that's something that would have been really valuable to me. The second thing was that I'd probably do differently would just try to maintain other aspects of my life, especially during dedicated. I think, when you kind of get into a mode mentally and you think about one problem or you dedicate all of your mental energy to one task, it can actually make your performance and your ability, in that task weaken over time. So just kind of, prepping and maintaining the other aspects of my life to be a well-rounded individual, even during a stressful time and demanding time.
Yeah, and to jump off that, I think you bring up a really good point. Wellness is a word that a lot of med students throw around, but don't really put into practice.
Yeah, and staff.
Yeah, and staff.
Right.
Everyone talks about it, but we don't do
Right.
it. But I think during the dedicated period, so my school had 8 weeks
Yes.
that they gave us.
Yes.
And if you think about it, 8 weeks doesn't sound like much, but it's actually 2 months of your life. It's
Right.
like 20% of the year.
Right.
So how do you maintain the right mindset so
Yes.
that you're studying the 10, 12 hours a day that you
Yes.
need to be?
Yeah.
For me, I felt like it was imperative to set up gym time or something
Yes.
along those lines. Cooking healthy meals, just
Yes.
make sure I'm focused the right way.
Yeah.
So I think I did that well, but some things I think I could have done better is I think I fell into a trap of resource overload in the beginning, the first 2 years, because I was testing out all these different things and people were giving me suggestions like do this book or
Right.
do this other thing.
Right.
I wasn't able to find a focus for myself. It wasn't until maybe even the dedicated period where I just committed to just one or two books as the core reference
Yeah.
materials. And if I could do things differently, especially in the first and second year, just be like, find one, stick to it, and then try to get the most of those course materials.
Yeah, that makes sense. I think there is value in selecting a few resources and knowing them well, especially if they're good resources. And just something that I probably would have done differently to add on to what you're saying regarding resource choice is, as I mentioned, the cumulative versus non-cumulative nature of the exams that we have to do during first and second year, and the split between healthy and non-healthy. That can make, as I mentioned, studying awkward. And I think AMBOSS and other resources are really being mindful of this and providing more structure to students such that they can actually approach Step 1 at a relatively early stage, and not encounter some of that awkwardness or feelings of inappropriateness that I kind of felt when I was studying for Step 1 in the beginning of M2 year, and not knowing what I should have known, what I should not have known, what I will learn, what I will not learn during my curriculum, and having a lot of those questions and doubts. So it's good to see resources addressing those concerns.
100% agree. Okay, next question. How do you make a study plan for Step 1?
That's a good question. So the first thing that I would bring is kind of like a general human psychology point, and that is, I think studies show that when folks are making plans and trying to predict how long it would take them to complete something, they usually underestimate the time by about 30%. So
I did not know that.
And that's something that I found, that's a trap I find myself falling into quite frequently, whether it's at school or in my personal life and things like that. So I would definitely, if I set goals for myself, do X QBank and complete it once or twice. You read these lectures and review the notes once or twice. I would try to guesstimate how long that would take to do, and then I would just go ahead and add 30% onto it. And I think that's really key, because if you don't build enough time into your study plan and you're inaccurate in your estimates, it's going to be hard for you to make changes to that study plan or put your study plan to the test. So if you're just making a study plan and following it through, that's going to, not give you an opportunity to really reassess if it's working for you and how you should change it and how you could change it. So that's why I think building in enough time to practice and evaluate how things are working for you is really important, and that's something I didn't do enough of. The second thing that I would recommend folks do is to kind of build their study plan around a resource that involves both active and passive learning. Active learning would involve things like questions and teaching other, fellow students, and then passive learning would be things like tables, charts, figures, lectures, stuff where you kind of take in the knowledge but don't use it. Right.
Yeah.
And I think both of those kind of, complement each other. Active learning is really good for making sure that, you truly understand the information and the reasoning is accurate to what the reasoning of the knowledge actually is. And that you're not just fooling yourself and maybe telling yourself a story that's not true. And the passive resources are good for understanding, general overview of what a topic means and sometimes specific details covered within it and how those all fit into place in a greater framework. And I think a lot of resources are implementing active and passive, but not every resource does that well. So definitely, I think looking for those two things when it comes to resource selection is something that I recommend a lot of students do.
Yeah, and I think one trap, just to add one last thing, is when you're studying, there's going to be things that you just don't know very well. I remember when I was going through step one, there was a hearing loss that like 3 things that they always test on hearing loss: otosclerosis, BPPV, that they always test. And then I'd for some reason keep missing it.
Yeah.
And a part of me was like, I don't want to study that today.
Yeah.
But I remember setting I keep getting this question type wrong.
Yes.
You got to just hammer that.
Yeah.
Because those are things, it might not pop up on the exam,
That's
but
right.
if they do, it's kind of a shame because you knew you didn't know that.
Right.
So just being cognizant of your weaknesses, writing those things down, and then spending some time to really hammer those instead of working on congestive heart failure that you've seen over and over again.
Yeah, no,
really
I totally agree.
Yeah.
Utilizing the analysis platforms or analysis tools built within platforms like AMBOSS, or developing some type of accountability on your own, accounting of weaknesses and accountability to address them, I think is key.
Mm-hmm.
And next question, Andrew, for you: what can you do to prepare and get into the right mindset for step one?
There's lots to unpack there. So in terms of how to prepare, I should have mentioned it earlier, but one thing I wish I did earlier is do a lot of the brute force memorizing things a little bit earlier in my studying. My reasoning while I was going through the process was, microbiology, immunology, those kind of topics, pharmacology.
Yes.
Those are pretty memorizing heavy. What's the side effect of a cyclovir, right? I always figured I could do this later.
Yeah.
But one thing I wish I did is just hammer those easy to memorize materials out earlier, so it's kind of ingrained in my DNA, instead of having to try to recall and then it gets all jumbled up because there's so much.
That's right.
So I think it's important for students, even before they get into dedicated, to start thinking about what can I just memorize, because there's not concepts tested there. It's just how much prep work I could do in advance. And that could be helpful so that when you're actually in the 8-week dedicated, you're not so stressed with oh my gosh, I still have to memorize all this stuff. Yeah. And the second thing about getting into the right mindset. Yep. And this goes back to my earlier point about just general fear of medical students. Right. I think it's important when you're taking the exam or getting ready for the exam to ask the right questions. A lot of underclassmen, when they talk to me, it's how did you get ready or whatever? They always ask things like how many practice tests did you do? Or how many practice questions did you do? And what resources did you use? I think those are good fundamental questions to start with. But what they should really be asking is how did you study? How did you think about a question when you were approaching it? Right. And I think too few students are thinking about that. Right. And they're
those
just
next
worried.
level questions.
Yeah, they're just worried about this guy did 4 practice tests and then got a 260. So therefore, if I do 4 practice tests, I shall also get a 260. Yeah. And that's just not the way it works. I have friends who did 1 practice test, didn't do that much, went in with, I'm going to try my best. I understand the concepts. Right. And they just knocked it out of the park. Yeah. Whereas other people, oh my gosh, I did 5,000 questions, 10 practice tests, and then you still don't get the result you want because you're not studying the right way and asking the questions to study the right way. Yeah. No, I think asking good questions of your classmates, asking good questions of your peers through different media, right? Yeah. Obviously, in person is one way to do that. You can do that online as well. And then also asking questions of yourself. As I mentioned, we can oftentimes pick resources which feel comfortable to us or they match our learning style, but then we don't really put them to the test
and make sure that they're working for us and they're giving us improvement in our
Yeah.
score, improvement in our knowledge, improvement in our comfort with the exam. And asking questions, I think, is key throughout the entire process. And the reason why I feel that regarding mindset is that when you ask the right questions, you can know that you're building the right prep for you. And then you ultimately just, at the end of the day, have confidence in your prep and understand that you've done everything you can to prepare well. And what appears on the exam, or maybe how your stomach feels on the exam, or et cetera, that's not within your control. But you have to kind of separate life just in general into things you can control and things you can't control. And the plan and the prep and your confidence in it is something you can control. And that's something I really recommend to folks to get into the right mindset for step one. In addition, to be honest with you, I think right mindset just involves comfort and familiarity.
Yes.
And I think putting yourself in the test-taking environment as much as possible, that kind of goes back to me wanting to do more questions.
Yeah.
I think that would have provided value to me. And ultimately, there are a lot of question banks out there. Not all of them are created equal, and not all of them mimic the tone, the difficulty, the style of the exam. So that's something to keep in mind when it comes to selecting resources and trying to find one that will allow you to get comfortable and put yourself in that test-taking environment, which I found to be valuable, and I think a lot of other folks find to be valuable.
Yeah. And then last thing, when you're practicing, make sure you're doing all random, timed. Because otherwise, you're going to show up for this thing. There's going to be like...
That's right. Yeah.
300 words that you have to read for a question, and then you just
especially during dedicated. You should take the training wheels off and really approach it in an authentic, true to form way.
Yeah, tutor mode is not the way to go at that point.
Yeah, I think that's definitely right.
Okay, again, this is a big one that everyone's here to find out. What's a golden test taking rule for step one?
Yeah, so if I had to find a golden test-taking rule, I would say more prep generally is better. Obviously, we talked about qualitatively, if the prep is not working for you, more is not going to be better. It's not going to help you. It's going to actually frustrate you. But provided that things are working for you and providing you're deriving some value out of your prep, I think doing more of it and starting earlier and making realistic plans, I think is really helpful. Beyond that, I really would like to question, in some ways, the premise of the question, because I'm not really sure there's something I can recommend that's going to work for everyone. Yeah. And I'll just give you a specific example, if I can. When it comes to, for example, approaching a question, a multiple choice exam, one question, you've got the prompt and then answer choices. Some people like to skim the prompt. Some people like to read it thoroughly. Some people read the prompt and then the question at the end. Yes. Some people read the question and then the prompt. And that's going to work for them based on their needs and based on the type of learner and thinker that they are. Yeah. So don't assume something you heard works for you, works for someone else. And that's why I think building enough time into your prep, starting early and really evaluating it moment by moment and stage by stage, like you mentioned, staging and blocking out your study is important, because that's going to allow you to determine if a resource is truly working for you or not, or if a strategy or tip or technique is working for you or not. And that's just so crucial to the whole process.
One thing that really worked well for me was... So there's different ways that everyone could approach a question. You read the question first, or you read the vignette first. It really doesn't matter. Right. But one thing I think is crucial, especially for all these questions that have a patient scenario, is before you read the question choices, you should have a diagnosis in mind. Right. Like if you think that this patient has aortic stenosis, you got to commit to that in your head mentally, because the question choices that you have are all going to look kind of similar. Right. And you could very easily get lost in the sauce. Yeah. And then you forget, oh, this one sounds right. But then you read it again and you realize, oh, wait, that's not aortic stenosis they're describing here. Yeah.
Especially on an exam that's increasingly clinical in its nature.
Yeah, you just have to commit. And sometimes you get the diagnosis wrong, but like at least you've committed to something before you chose an answer. And I thought that was a good strategy, especially for step two. Step one as well as it changes over the next few years.
Yeah, definitely. I can see that working. Cool. Next question would be, for you, Andrew, what happens if my step one score isn't as high as I wanted?
Oh, okay. All right, where's the camera I could look at? All right, guys. Life moves on. That's basically the whole thing you have to think about. All right, when you go on YouTube and you type in step one score, what you're going to find is the dude with the 250 or the 260. He's like, oh, yeah. I just did like this question bank. I read first aid like cover to cover 3 times. And that's how I got the 260. fine, good for that guy.
Right.
But you never see like the guy with the 230 or like the 220 talking about it because they're kind of embarrassed by the score or whatever. But then you have to remember, like, half of the med students taking the test are scoring like 230 or below. That's just how percentiles work.
Right.
You did health system science. So
Right.
So one thing I think was told to me, and we talked about it earlier, is if your step 1 score isn't good,
Yeah.
fine. Like, you have to, instead of saying like, oh, it was like a bad test day, or like blaming the situation or blaming some outside factor, kind of look internally. Like, it might be because you were sick or something, but it might also be you didn't study well.
Right.
So the uptick or the upside is you have opportunities. Like for me, or like for any student now, it's like you could think about the clerkship years.
Right.
Making sure your grades are good.
That's right.
That's one. There's also step 2. If you didn't score well and you want to go into a competitive specialty, like take step 2 early.
Right.
Everyone tells you these things. Like, it's not just step 1 score, you just didn't score well, and then your life is over.
Absolutely.
Yeah, like you're still living, breathing.
Things move
on.
Right. There's opportunities.
There's a lot of opportunities, and the big thing to push is that I like to tell people is if your step 1 score isn't good, like, don't blame the situation that much. Like, you can sulk for a little bit, but think about like how you could do better, or like other areas you could work on.
Yeah, no, that's definitely right. If I could kind of add in some ways, I guess, rephrase what you're saying.
Yeah.
A lot of folks, when they get bad news or something bad happens to them in their life, they think they're going to feel that way forever and that they'll never recover. But really, I think one of the things about people that makes us unique is how we can adapt. To different circumstances, different ways of living, different developments in our life, etc. So always be confident in your ability to adapt and make the most of opportunities. And ultimately, I think if the score isn't as high as you wanted, I think a key thing to keep in mind is that you do belong ultimately in the medical school process. And the reason you got into medical school to begin with was not to achieve high numbers on an exam, but to actually use your talents and your compassion to care for other folks. And that kind of goes right into what you were saying about future opportunities, because for most people, the moment they complete step 1, they'll probably be entering in the clinical environment. And that's going to be a great reminder as to why you got into the whole business to begin with, and provide you with motivation that's going to allow you to, really understand exactly why you do what you do from day to day, and how that is a core part of your identity more than just a number on an exam.
Yeah, and to just give a little personal anecdote out of this, I have a friend of mine who, in med school, he wants to do orthopedics.
Yes.
Step 1 score wasn't as high as he had hoped based on practice tests or whatnot.
Yeah.
But then he was going through clinical rotations, and one day he was checking his pocket, his white coat pocket, and there was a postcard or a card from a pediatrics patient that he took care of. It's like, hey, I really appreciate you taking care of me.
Yeah.
And couldn't have asked for a better medical student, something along those lines.
Right.
And I think that's the key, right? You have to think about like why you did this for the first place. It's not like, hey, let me get a 250 on flex on everyone.
Yes.
That's not the goal.
Right.
The whole point was you're going to be a doctor. Right. And if you passed step 1, you're going to be a doctor.
Right.
So from whatever perspective you see that, you're still achieving your dream.
Yeah. And I think dealing with some of the challenges can actually probably be good for you in the long run, and empathizing with patients and providing them with good care. So just look on the bright side as much as possible and keep your eyes open to those future opportunities.
Mm-hmm. Okay, this is our last question.
Okay, sounds good.
Yeah. So Sean, this is for you because you've kind of been through that whole process.
Yeah.
How does the step 1 exam affect your life long term?
So I would say the results of step 1 are more so a midterm thing. They're important midterm, as I mentioned before, when it comes to the residency process and where you end up and what you end up studying. Mm-hmm. That's important, and that's always going to be important. But long term, I think, like I said, people derive value, from medicine for different reasons. And one of those reasons is that they have the opportunity to care for others and really, use their talents and compassion to help them. So at the end of the day, as long as you stick with the process and you maintain, your interest in medicine and you keep at it, and you're proud of yourself for even trying, ultimately, I think it's not that big of a deal. At the end of the day, folks that I know who are in residency right now, their step one was important in getting them to that residency, but their performance during the residency, how much value they derived out of it, how it informed their future life choices, how it made them happy really, or how much happiness they feel about their step one score isn't really important to them. It's kind of, it forms the background of their biography and isn't a core, feature of who they are and what their story really is. And they're thriving, so I feel no concerns about anyone taking step one really. Yeah. And in terms of me, it turned out to be not that relevant at all because I didn't go through that residency process. Step one was something that I could put on my resume and maybe attract employers or show them I had certain skills when it came to basic sciences and test taking and things like that. But ultimately, now I'm just kind of in the private sector, and it's not something that really I think about or matters too much.
Yeah, and I can't comment on the long-term implications of my step one score, and I'm still waiting on my step two score, by the way, so fingers crossed.
Yeah.
But I think I speak for all medical students when you take this exam. You're just glad you're done. You don't really care what happens. You have 3 weeks to not worry about anything. And you're just happy to be part of the process because I remember finishing my step one exam. I felt like I didn't even know what to think because I was... At the end, I was like, oh, okay, I just want this to be over. Yeah. And then I met up with one of my physician mentors who I do research with. And he just looked at me, smiled, and he's like, oh, you're part of the club now. Like, you've endured one of the defining moments of med school. Right. I think you could just walk away with like, I survived that. And that's all. And then if you did the necessary prep work, you probably did well on the exam. Right. So don't worry about the outcome.
That's right. Yeah, definitely. Proper preparation prevents poor performance. Yeah, is something I like to think about. Yeah. And it's something that you'll remember, and it's something that, like I said, is a part of your biography, but it's not a key component. Yeah. It doesn't define you. It doesn't define how people think about you. Really, your identity in the clinical environment or in society in general is going to relate to how you care for people, how effectively you do that, how you make them feel. And step one is not a major component of any of those things.
Yeah. Yeah, how many times have you asked in attending like what your step one score was?
Never. Yeah. I probably would have gotten a terrible grade if I did.
Yeah, it's like, like what Q banks did you use?
Yeah, absolutely. Okay, so with that, I'd like to wrap up. Thank you for joining us today. We hopefully touched on some important questions that address some of your concerns and things you were curious about. But if not, we'll be sticking around here to answer some additional questions in the chat box. So be sure to visit that and look for our responses to the questions that you pose. Additionally, I would like to let you know that you'll be receiving some AMBOSS access through a code. And as always, keep in mind additional content that's coming from AMBOSS in the future. We're always producing new content that hopefully can provide value to you and meet your needs. So keep your eyes open for that. And with that, I'd like to thank you again and thank Andrew for joining us.
Yeah, well, I enjoyed being here, and this is something I always wanted to do. So click on Sean's head, above Sean's head, to subscribe to the channel. And then click down here for likes, to like the video. Yep. And thanks so much.
Thank you again. Bye now.
Woo!